Thank you. And that brings us to Dr. Ansher from our Public Health Department. Welcome, Dr. Ansher, and I know you're going to bring us up to date on some of, everyone's talking about vaccines. It may be a long haul from now, but any information you can impart is welcome. Thank you.
You're welcome. Here we go.
Do you mind just cleaning off the...
Oh, gosh.
Thank you.
Yeah.
And this is forward?
Yeah, the arrow going that way will get you forward.
For the Prince William Health District. I'm going to provide an update on our vaccine distribution planning. VDH and the Prince William Health District will be the lead in this endeavor. As most of you know, recently Pfizer vaccine was given an emergency use authorization and has begun to be distributed to our hospitals in Virginia. Some of our hospitals will receive vaccines from their mother hospital. For instance, Centera Hospital will receive vaccines from Martha Jefferson in Charlottesville, which is part of the Centera system. And Novant UVA will receive vaccines from Inova Hospital, because Inova Hospital has the capacity to hold cold storage. Virginia, for the month of December, will receive approximately 480,000 doses. That'll be enough to vaccinate their healthcare providers, as well as folks in the long-term care facilities and their healthcare providers in those facilities. The reason why they are priority with this limited vaccine is, number one, a significant number of healthcare providers who have been caring for patients with COVID-19 have actually come down with COVID-19. In the United States, it's over 250,000, and unfortunately, some have actually died. The reasons why long-term care facility residents have been chosen is because they have the highest incidence of infection, as well as the highest incidence of death among our Americans. So therefore, that's why those two groups were chosen for the primary vaccine distribution. Okay. The vaccine is going to be distributed in a series of amounts. Initially, of course, since we only have Pfizer vaccine, that again is going to the hospitals. And as you see again, it's a highly targeted campaign, which those first doses are going to long-term care facilities as well as healthcare providers. EMS and fire and rescue is within that first phase. The priority group 1A, because they do have direct contact potentially with COVID-19 individuals, whether it's known that they have COVID-19 or not. As 1A rolls out, the healthcare workers will initially receive their vaccines through the hospital systems. That'll be Pfizer. On December 17th, we're hopeful that the second vaccine, Moderna, will be going for an EUA, approved on the 18th, and then the ACIP will make recommendations as to whether it should be approved and who should be priority in receiving it, and it might begin to be sent out or distributed on that Sunday, and perhaps those hospitals that are the hubs will receive it on Monday. the advantage to the Moderna vaccine over the Pfizer vaccine, it does not require ultra-cold storage. Originally, the long-term care facilities were going to receive the Moderna vaccine, but CVS and Walgreens that will be doing the vaccination in the long-term care facilities have the ability to manage and have been managing ultra-cold storage products. So they will be getting this Pfizer, and the local health districts will be getting Moderna vaccine, as well as the hospitals will be getting both Pfizer and Moderna vaccine. This infographic shows where we'll be. Starting, we're hopeful that on the 21st of December, we will be receiving vaccine, Moderna vaccine, to vaccinate our EMS and fire and rescue partners, as well as any of our public health and medical reserve corps individuals who work in the vaccination clinic. We've been planning with our EMS partners where we're going to vaccinate them, how they're going to schedule their appointments, and how we're going to move forward beyond our EMS partners into other healthcare workers that do not have connections to a hospital and therefore will not be getting their vaccine from the hospitals. I do want to say the Northern Virginia health directors have been working very closely to coordinate our vaccine distribution. We've been working with the Northern Virginia Hospital Association, as well as our local hospitals, in particular quite a bit with Inova, who does do our all Northern Virginia's occupational health programs.
All right, good afternoon, Madam Chair, members of the board. Brian Meisner, our Emergency Management Coordinator. Just going to talk briefly about the county's efforts supporting the health district as they look to the rollout of vaccine. The first thing we've done is, at the request of the VDH headquarters and the health district, we've used the criteria they've given to work on prioritizing county staff in the various categories of very high, medium, down to low risk, so that they have good numbers and planning assumptions for the amount of vaccine that they'll need to order for us here in the district as the state notifies them it becomes available. We are currently prioritizing those agencies and personnel for phase 1 and 2. So those are the folks who are coming into direct contact with constituents and the general public who are at a higher risk of exposure to COVID-19. We're also working with our communications team from Executive Management Communications, the Health District and their Public Information Officer, as well as colleagues in the cities of Manassas and Manassas Park, to make sure we've got a really good, robust joint information center here at the sub-regional level, so that way we will have one message broadcast out the same way with many voices for all of our stakeholders and for the general public to understand when it might be time for them to receive a vaccine, or if somebody is a member of one of these priority groups, that they will understand what that process looks like for the jurisdiction that they work for. We are also providing some logistical support to the health district. We're working on site selection based on some of the existing point of dispensing sites they had pre-planned, and some of the sites that we've used for testing with some other community partners. There will be a very limited number of sites, and because of that, they do need to be larger and have lots of throughput. There is a need for there to be parking for people to wait up to 15 minutes after they've received the vaccination to make sure they don't have an adverse reaction. So it is a structured process with some criteria they've given us, and we're going down our list of resources to make sure that we're ready to go when they tell us the time comes. And with that, we'd be happy to answer any questions you may have.
Madam Chair.
Supervisor Franklin.
Thank you for the presentation. I think this is welcome news, so it's good to see this on the horizon. Just so that everyone is clear, can you just briefly go over the difference between the Moderna and the Pfizer vaccines, just very briefly, just so everyone is clear?
Both of them are made by a relatively new technology that actually, though, over decades has been studied. It was used to make the Ebola vaccine, so it's not 100% brand new, but it is brand new for this particular virus, this virus that's new to us. It works such that does not impact our ability to test people to see if they've had a previous infection. It's just the genetic material from the virus, and that's not what we test for when we look to see if somebody has an infection, so that's good news. But what it does is it helps our body recognize that this piece of genetic material is abnormal and make antibodies against the virus. This genetic material does not enter our cells. It does not impact our genetic material, because I know that's a concern for folks. It helps make antibodies, what we normally do when we have an infection. We make these proteins called antibodies to protect us. We do both of them. You need 2 doses. For the Moderna, it's about 28 days between, and for the Pfizer, it's 21 days between. The Pfizer vaccine is very delicate. It requires ultra cold storage, which is about minus 70 degrees, which is a special kind of freezer. It also requires, it has to be diluted to be used. Whereas the Moderna vaccine is stored in regular freezer temperature, like we might do with other vaccines childhood vaccines that we give. And it doesn't require to be diluted, but it does require 2 vaccines.
Great. And then for the timeframes, I know you mentioned we should start receiving about 480,000 weekly starting in
It's
December.
not weekly, it's total in December.
Okay, gotcha.
So it's weekly.
But for each of the phases, can you describe, well, I guess we only talked about phase 1, but when do those individuals get to be able to receive the vaccine?
We don't know,
Okay.
because as other manufacturers get approved, Johnson & Johnson probably will go for approval in February. And then AstraZeneca, we're not exactly sure, but probably will be also around that time, if not earlier. So we do have other vaccines coming on board, so we don't know.
Okay, and then the last thing I was just going to mention is, you've probably heard this, but within the minority community, there's some hesitancy for the vaccine, particularly within the Black community. So just making sure that we can do the level of outreach necessary to encourage individuals to take the vaccine, and really partnering with Black and brown groups that can also do outreach with those communities and letting them know that, these vaccines will be safe, and we trust that they are, but there needs to be specific outreach done in those communities. So I trust that you all will make that a priority, and obviously those of us on the board who represent those communities will do so as well.
The Virginia Department of Health has been having town hall meetings, virtual, for various groups that might be concerned, more concerned about obtaining the vaccine. It's been sort of listening so that they can get information and know how to provide information to those particular groups. The state has hired a company specifically for the Hispanic Latino population to understand their concerns, how to address those concerns, and how to communicate about the vaccine for that particular group also.
Supervisor Angry, then Supervisor Canlin, then Supervisor Bailey.
Thank you, Madam Chair. And thank you, Dr. Ansher and Mr. Miser for this presentation. I'm curious about, okay, so we're at a point now where we've gotten a vaccine, but right now the positivity rate of the COVID, confirmed cases are going through the roof, skyrocketing through the roof. And we know we still got to get through Christmas and New Year's. I'm curious about COVID-19 testing. Like, how long will we keep that up? Is there a planned end phase of that where we start to get into vaccine, or is testing going to continue throughout this thing? I'll just say this and then let you speak. But I know 2021 is not going to be still the great year that we all expect. We're still going to go through masks. We still got to go through how are we going to get this out to an entire, nation, and let's just speak for Prince William County, to 470,000 residents, if we will. And so, is there a phase on that as far as COVID testing goes, or at this point, because we know this rate is through the roof, is our focus now getting this vaccine out and really trying to get people, and that recognize we only have a certain amount of doses per month?
Luckily for us, the Virginia National Guard is going to be available through March. We had one testing site on December 7th. We wanted to have one on Thursday. Still planning to have one on Thursday. Hopefully the weather won't negatively impact that. And we had tentatively planned to have another large testing site, sort of timing it so it's after Christmas and New Year's, so we can, really assess how much disease transmission we have in the community.
Yes, and thank you. Oh.
And just from the county perspective too, we are talking with our partners at Centera, just confirming capacity and are planning to go beyond the new year if that should be needed. There is still quite a bit of testing capacity in the community, but we are sensitive that some folks may not have access, so we're still working with Dr. Ansher and her team, and also still checking in with the Health Equity Group from the Governor's Office and DDH with the data tools they have available to us to help indicate where there might be pockets of unmet need.
Yeah, and thank you, because I'll say you have done a yeoman's work of getting us to this point thus far. And so this is for the community during this presentation. The number one thing that we can do as citizens is wear a mask, practice social distancing, wash your hands every chance you get, because at this point we need to hold what we have so we can get this vaccine into a position that we can start lowering these numbers. And so I just want to put that out there for the public, because you've done the work to get us this far. So thank you very much.
Thank you, Madam Chair. I've got a question on logistics, and I've got a question on the vaccine itself. As far as logistics go, from what I'm seeing in this presentation, a lot of the bottleneck will be the receiving of vaccines to distribute. But I want to make sure that there's nothing here in Prince William County, that there's no bottleneck in the distribution of that vaccine. In talking to the EMS partners, is there anything that we can do as far as providing resources? Are we in a position and ready to go so the distribution of that vaccine is not the problem, just how many vaccines we got? Anybody who wants a vaccine and we have available vaccine to give, I don't want that to be any sort of issue in the distribution of that.
Sure. Thanks for the question, Supervisor Camlin. So I'll start, then I'll ask Dr. Ansher to join in. In terms of what they've asked us to pre-plan, and in terms of some of the ordering we've done for site support equipment, we are ready to go. So based on the planning assumptions they've given us for the number of sites, we have that equipment on hand today. The large testing events that the National Guard's coming in and supporting the health district with, we're actually exercising that equipment to make sure we've got it down and it's as fast and expedient a process as possible. So from a county perspective, we're prepared to support. And then I'd ask Dr. Ansher to speak briefly on the VDH component of how that vaccine's allocated and moved throughout the state as we get through the phases.
Okay. And Dr. Ansher, if you can also talk about the vaccine itself. If somebody receives the vaccines, and from my understanding, there's 2 shots that you need to receive for the vaccine. Once they receive that vaccine, are they still able to be carriers and spreaders of the coronavirus and still have the need to wear masks until everyone else is vaccinated? If you could talk a little bit about that, because I think some people out there think, and to Supervisor Angry's point, that once you get that vaccine, then it's spring break and we can all get back to having a good time. But if you could provide a little bit more information on that, I think that'd be helpful.
Okay. I'll just start with distribution. We've had, let's be honest, we don't anticipate 100% of the population initially wanting the vaccine. But as we get through the healthcare workers, the long-term care, and are moving towards get through some of the critical infrastructure, and as we're moving towards the entire population, we have signed up various commercial pharmacies to assist doing the general population. A whole list of them have signed up to help with that. Additionally, we have some local providers. The federally qualified community health centers signed up. The MAP clinic signed up for the more vulnerable population. So that additionally will be helpful beyond the Prince William Health District vaccinating the general public. You're right.
And I'm sorry, just before you, sorry to interrupt. Is there going to be a cost associated? Okay, so I want to make that clear that if somebody wants to get the vaccine, that it's not going to cost them anything or have to go through their insurance company to receive it.
Certainly, if they are insured, they the pharmacy, not public health, but the pharmacy can charge the insurance company. The individual will not be charged. They can charge an administration fee. They cannot charge for the vaccine. Somebody who's uninsured, they can bill HHS for the administration fee or just not bill anybody, and the person will not be charged for the vaccine. Okay. As with any vaccine, the day you get the vaccine, you're not immune. You still have, your body has to have time to make those protective proteins or antibodies. After 2 vaccines, it would take a couple weeks before your body makes enough antibodies. We don't know enough about the vaccine. The 2 that we have right now are 2 doses. Johnson & Johnson is 1 dose. I believe AstraZeneca is also 2 doses. We don't know enough about the vaccine to know how long that those antibodies or those protective proteins last. That will take time to know. We do know with the first 2 vaccines, Moderna and Pfizer, they did not look at can it prevent transmission of the virus. What it looked at, they are in the process of, but what they've looked at is just, it doesn't necessarily prevent somebody from getting infected. It prevents people from getting severe disease. Will we find out it prevents them? That will take time. The Johnson & Johnson vaccine did AstraZeneca did study transmission, and it did show that it prevented transmission of the virus, but as you know, the first 2 are Moderna and Pfizer are over 95% efficacious versus AstraZeneca is 70% efficacious. But annual flu vaccines sometimes are only 50%, so that's still, more than the usual vaccine. And same thing with the flu vaccine. You can still get the flu, but it's generally milder after someone's been vaccinated.
Supervisor Bailey.
Thank you, Madam Chair. Brian, I just wanted to, first of all, thank you. And my question was really what Supervisor Canlon just asked about the logistics. One of the opportunities we had with the COVID testing was communication with the board so that we are in sync with you to make sure that we're communicating with our constituents. So just a reminder, if we could pick up from there in terms of the communication with us, I think that's essential.
Yes, ma'am. So, as part of our outreach campaign that we are collaborating with the health district and our partners in the cities, there is both an internal and external component to that. We will make sure that the board is apprised and has an opportunity for feedback as we're communicating with various parts of our community. In terms of kind of the site selection piece, we're pretty constrained with the assumptions the health district has given us, but we will make sure those channels of communication are there so that if there are parts of the community in your districts that need service or just aren't able to access, that feedback loop will be there so that we can find ways to get them to a site or a provider perhaps.
And the other thing, thank you for reminding me of this. Will the once we get into this and you get a rhythm with it, will the process for administration be similar to the COVID testing, or will you have to create something differently? I'm assuming you will.
I'll let Dr. Ansher speak to that. It's really the healthcare community. So, public health will be doing some, but it is the larger healthcare community that will be actually doing the vaccinations.
Because of the cold weather, obviously, what's been ideal is the drive-through. And if we were in Florida and the weather was always warm, that's probably the option we would choose because, as you know, we have to social distance. It isn't like H1N1 where when we could line up people and people didn't have to social distance and we could just, push people through to get vaccinated. So we're scheduling appointments. People will schedule appointments so that we can ensure that we have appropriate social distancing. But as the weather gets warmer and we have a larger number of folks to vaccinate, our EMS, our emergency partners have got it down to a T on how to do a drive-through, and we can do drive-through vaccinations.
Supervisor Brody.
Thank you, Madam Chair. Thank you, as always, Dr. Answer and Mr. Meisner for your presentations and for this timely update. I guess my question is in terms of phasing, as we shift from later phase 1 into phase 2, you had the slide up talking about identification of county staff at highest risk per BDH definitions, phasing prioritization guidance. I would imagine that as we're looking at that, we're looking at, everyone in the organization, folks that are frontward facing first, and then our healthcare folks. But then after that, how are we looking in terms of the school division? Because obviously we have a lot of employees within the school division that are frontward facing, that they come across a lot of students, especially as we go back into getting back into in-person learning, that they are definitely frontline workers as well. So can you elaborate a little more about where they fit in the equation?
Well, that's Dr. Ansher to comment on the school division, and just briefly for our staff, we're fortunate that we have the Department of Labor and Industry guidelines that have already told us we had to classify all of our staff into categories, so we're using that as the basis for that ranking process with our Risk and Wellness Services team. I'll ask Dr. Ansher to talk about the interactions with the schools.
Well, I just want to, even community services has healthcare workers, so there's some agencies that you might not think of as having healthcare workers that will be the first to get the vaccine. There are among your agencies here in the county. Teachers are part of critical infrastructure, so they're the 1B. So after we get the healthcare providers and the long-term care facilities, and healthcare, it's really a healthcare worker. It's very broad in the sense that anybody who works in a healthcare system, so it could be folks that are healthcare providers, as you typically call it, or people front desk or whatever in a doctor's office who can come face to face with the client. Then we move on to critical infrastructure, which teachers are part of that vaccination.
Thank you very much. Well, I assume these slides will be given to us electronically. Appreciate it. Thank you.